COVID was kind of the tip of the iceberg amongst all the other things that our community has had to face.
Yeah.
And much like other things, COVID wasn't handled well when it came to our community.
Welcome to another episode of the BHPN Podcast Series. I'm excited to be joined today by Shanique Victoria Edwards, who is a registered psychotherapist here in Ontario, Canada. Shanique, thank you for coming in today.
Thank you so much for having me. I'm excited to be here.
Great. So you're running your own business as a psychotherapist here in the GTA. How long have you been in practice?
So I've been in independent practice now about 2.5 years.
Okay.
Yeah.
Was that the plan from the beginning, or did that sort of just unfold on its own?
To be honest, a lot of my career has unfolded on its own, to be honest. I've kind of just been along for the ride with it. But I knew at some point that I'd want to have my own thing, my own entity. But I also knew that I wanted to be able to work and do multiple different things and not necessarily be boxed into anything. And it just so happened that being in private practice really allowed me that flexibility that I was looking for.
Okay, so you're able to kind of create your own schedule and you're your own boss.
Yes.
and that was something that you figured out on your own, and I assume maybe you're still figuring out how to run a business.
The latter, still figuring it out. I've been blessed to have really great mentors along the way, folks who've come alongside, who've done some of this before in their own rights in terms of starting up a business and what are the things that you need. And so I've been really, fortunate to have a good team of people surround me along the way, but definitely still figuring out the ins and the outs and some of just the nuanced things, like who knew you needed a bookkeeper and an accountant, or are they different? Are they the same? Like simple things like that, or just also administration and all of that comes with owning your own business. And so, at first you think you're kind of delving in, you get to do all the things that you really love to do. And then there's also these other parts that you have to also be responsible for.
Right. So, as a psychotherapist, certainly you could have chose to go work in, say, a healthcare facility, a hospital, or join an existing network, but you wanted to do your own thing, right? And that's a decision you've made from the get-go, correct?
Essentially, but I did split my time. Like even now, I still work with a community organization. I did also work with a community organization when I started my practice as well. And I feel that because I kind of have my feet in both worlds, it does give me great opportunity to be able to support our community in terms of just providing greater access within my private practice. I can offer a sliding scale because I'm not necessarily wholly dependent on my private practice to bring me in my income. I do have other resources and revenue streams that I can rely on, so that way I can create that balance. That was really important to me.
So you do have a number of revenue streams, and it sounds like that's important, right? Because you never know what's going to happen. There's obviously a little bit of uncertainty and sometimes instability in the market. So can you talk about that part and how that plays a role as well?
Yeah, absolutely. I would say like my kind of areas of focus of late have kind of probably fallen into 3 buckets. So I do the clinical care, that's psychotherapy, that's, based on community organizations, as I mentioned, that I work with, but also within my private practice. I would say the other focus has really been on capacity building. So with some of the organizations that I partner with, I do trainings, I facilitate workshops, I do speaking engagements. And so really and truly about how to help clinicians, individuals, organizations best serve the mental wellness of our community. And then I would say perhaps maybe the latter bucket would probably fall in line with like advocacy and knowledge translation. So, really amplifying Black scholarship and driving forth our research into like practical and usable tools. And so I've been really kind of focused on that piece in terms of tool development and creating a framework that clinicians and organizations can then utilize within their organizations to support equity and Black-centered care. And so I've been doing some trainings and licensing and things like that around that framework as well. So that's been another stream for me.
So that's really important, diversity, equity, and inclusion. Yes. There's a lot of that happening within the corporate world as well. So I'm sure there's some opportunities that come up with corporations and giving seminars.
Yes.
So that's great.
Yeah.
Now we're curious to know, tell us about your upbringing. Where were you born? What's your family background? Where are you guys from? Tell us about that.
Absolutely. Born and raised in Scarborough, Ontario. Now Greater Toronto area, I guess, but will forever be Scarborough for me.
Yeah, it was Scarborough at the time, I assume, right? Okay.
Yes. My parents are both of Jamaican background. They were both born in Jamaica and then came here and had me and my siblings. And yeah, I grew up in, pretty like modest, my mom and dad, both really hardworking individuals. Education was key in our home. And so that was driven in from a very young age that some form of post-secondary school was not optional. It was a must, a necessity for us. And so I always kind of had my eye on going into something healthcare related. I will say my dream was to be a neurosurgeon.
Really?
That was my dream. And I did my undergrad in neuroscience and psychology. And then, life happens. But in a really beautiful way in terms of psychotherapy really found me. At that time, I didn't really know about it too much. I was more familiar with social work at the time. And then ended up speaking to somebody who was a representative of the school that I had gone to. And it just kind of fit for me, this marriage between the brain and human behavior and then being able to support people still really kind of came together. And then that became my journey towards finishing my degree, which took me quite some time. I was kind of doing it myself, brick and mortar, and was really kind of focused on not coming out with monstrous debt. So I took my time and I kind of just paid it forward and then I completed it. And so now I'm here. And a lot of the opportunities as well that has come out of it have also just found me. I do a lot of work focused on racial trauma and complex trauma. And people always ask me, like, how did you get into racial trauma? And it was like, it was just somebody approached me about working on a project. And I just was like, oh, this is really interesting that there's a term for what we experience day in and day out. I got to figure this out and learn more about it. And that just kind of catapulted into a lot of what I've landed in now.
So it sounds like that area found you, racial trauma. I mean, sometimes that's how it goes, isn't it? It's not, you don't even know that it exists, but you find out about these opportunities and it just seems to stick, right?
Yeah, absolutely.
Well, that's great. So your parents were immigrants from Jamaica. Did they have higher education or?
Yeah, my mom. So my mom went all the way up into doing her master's here in Canada. And she also did a career switch when I was in high school. So she was an accountant while we were growing up. And then she pursued her passion for teaching and she became a teacher. And my dad has always kind of been an entrepreneur, having his own businesses and doing his own thing. So he didn't go on to post-secondary education, but he did definitely show us, the importance of having those multiple revenue streams and being self-sufficient and hard work. They both really kind of instilled in us hard work. Yeah,
that's common amongst new immigrants to Canada. I can say my dad, he didn't do higher education, but he always knew that he wanted us to go on to do, a minimum undergrad degree and certainly encouraged us to shoot for the stars. So that's, I think a commonality that many people hear, that I'm hearing a lot, whether it's people from the Caribbean, from Africa, from other places, education's always an important thing.
Absolutely.
And how many siblings do you have?
So I have 5 siblings in total.
Wow.
Or there's 5 of us in total. Yeah, 5 of us in total, 4 siblings.
Okay. And are you in the middle? Or
I'm the firstborn.
Really?
Yes, I'm the eldest.
So you had to kind of set the path and set the standard for everyone.
I would say so.
Okay.
Yeah, my sister would arguably say that I'm probably the quote-unquote angel of the bunch. Always had to kind of set that example,
Okay. Now, growing up in Scarborough, I imagine it was a pretty multicultural situation in high school and whatnot. Interestingly,
not so much in high school, just because of where I went to high school. But I would say my elementary school, it was quite diverse. And then, when I was in high school, was fairly, but I was still quite a minority.
A minority, okay. And then where did you do your undergrad?
U of T.
U of T, okay. And how did you find that? Were you Were there many Black people in your classes, or did you notice that there was an underrepresentation? What was that like?
I would say definitely an underrepresentation. I mean, going into psychology itself is such a huge program.
Yeah.
And I had the opportunity of being at both campuses, Scarborough and St. George. And so
Okay.
being able to just see that variation as well. I definitely would say the Scarborough campus probably had a little bit more than the St. George campus. But yeah, definitely an underrepresentation.
Okay.
Yeah.
And did you have any mentors throughout this process? Any Black professors or anyone who
No.
mentored you? Really?
No, not at all. It wasn't until I went on to do my master's that we had a Black program advisor.
Okay.
Yeah, for our internship. But apart from that, along my education journey, I never had a Black.
You didn't? Okay.
Yeah,
Was that challenging for you, do you think? Did that have an impact?
To be honest, I don't know if it really had an impact on me because it was all I ever knew. Like
Yeah.
I only had non-Black educators. However, when I look at, for example, my sister who did have a Black educator and how much he poured into her in her younger years, it was in elementary school that she had that. I could definitely see how I could have benefited from having that experience.
Yeah.
But because it was my norm, I don't think that I really noticed that it was anything
It was
that
just
different.
normal,
It was just
right?
normal.
Okay.
Yeah.
Yeah. Same here. I mean, I throughout high school, throughout university, it was predominantly white teachers, and you just get used to that part, right?
Exactly.
Okay.
Yeah.
So during your education, did you get any business 101, any courses on business, anything at all?
Nothing.
Nothing.
Nothing. The one thing I did know was that I needed to leave school with a job / career, but more so a job.
A job.
And because recognizing that, especially coming from a psychology background, it takes time to build that career.
For sure.
So it was really important for me that like whatever I was taking in school, I actually did in my final year of university, I went to college and completed a lab technician course.
Oh, really?
So that I could at least know for sure that I could have a job while I figured everything else out afterwards. And so, yeah, once I came out of school, I worked as a lab tech for a while and a
Really?
phlebotomist. And that kind of also helps, kind of catapult me into paying for my master's and things like that as well as other career opportunities.
Okay, that's really interesting. So you were working in clinical settings, taking blood, the whole 9 yards there. Were you working for any particular company like Life Labs, Dynacare, or was
No,
it?
I wasn't working in any company. I started off in a doctor's office.
Okay.
And so I would do like vaccines and things like that.
Oh, good.
And then I ventured into research, and that was kind of my first taste of research. And I was drawing blood for the research projects.
Okay.
And then I ended up moving more into like more of the administrative space and working. That was kind of also my first taste with mental health, working in child and youth mental health is in administration, and then kind of moved up the ranks into research again.
Really?
So yeah,
During your master's?
during my master's,
Okay.
yeah.
What was the research focused on in your master's?
So for my master's, I did a focus on racial trauma and post-traumatic growth factors for BIPOC communities. And really kind of a lot of the work looks at negative implications of racial trauma. I really wanted to focus on the fact that our community has overcome a lot of that to get to where we are.
Yeah.
And so that really made me focused on those post-traumatic growth factors and how they influence our ability to withstand racial trauma.
Okay, that's really interesting. Was that also at U of T?
No, so that was at Tyndale University.
Okay,
Yeah.
great. And then, so now from there, you're in your practice. What types of clients do you typically see, and what are the main concerns that you're dealing with in your practice day to day?
Great question. When folks ask me that, I'm like, it depends on the day, really and truly. It depends on the day, which is why I love it. But I mean, I see clients that have some of the common mental health conditions, anxiety, depression. I work with a lot of members of the Black community as well. And so with that comes a lot of complex traumas. And so my practice is really kind of morphed into really trauma-focused care and helping the Black community, not just in terms of, some childhood traumas, but intersections with racial trauma, identity-focused traumas. And so I would say it's quite a plethora of different experiences. And not only do I work with individuals, but I work with couples, I work with families. So I'm able to see quite a range of different things, I would say, which has been really, amazing, I would say, in my own growth.
That's great. So it's a fairly diverse population.
Yeah.
But it does sound like you have that specialization with the racial trauma.
Yeah.
And why is it important, do you think, for Black patients to have a Black therapist, or to have that option at least?
I think the option is important because I do know some clients who have non-Black therapists, and I know some non-Black therapists who have done a lot of work on themselves and to understand our community to be able to provide that level of care. But I do think it's important for them to have that option and to have that access because, showing up in a space where you are about to basically emotionally undress and become vulnerable, to have somebody of a kindred spirit, who can understand the nuances of your experience and not having to over explain, in so many different spaces, Black folks have to overfunction to finally be in a place that's supposed to be healing and not having to overfunction, not having to overshare. It's just, sometimes clients will come in and be like, so, this is how it was when we were growing up. And they're like, you understand, right? I'm like, yeah, I totally get it. And I could totally see how that has impacted the way that you are today. And I'm not just saying that because, I'm trying to put myself in their shoes. I'm saying that because I was in their shoes. And I know exactly what they're talking about. And from that perspective, I think it does help to feel as if you have some connection somewhere, especially if you don't necessarily feel like you have that in the outside world.
Yeah, it is very important. And we know even from, not just from mental health problems, but also medical problems, some patients prefer to have a provider that looks like them, right? And being able to seek that out is important. And that's one of the reasons why we have our directory as well, where we list sort of Black healthcare professionals from different sectors, try to get patients access, because sometimes it's hard to find people, right?
Absolutely.
You can't just know by someone's name necessarily. And that might make a difference for a patient to have someone who understands what they might be dealing with on a day-to-day basis. Now, with the racialized trauma, can that also manifest as, really minor things like these microaggressions that we hear about? Can you talk about that and how people may not even be aware necessarily of the trauma they're experiencing?
Yeah, absolutely. And it actually ties into something that I wanted to say on the past point that you just made too, is, the importance of having somebody that looks like you is being able to recognize symptoms. Because with certain things like, for example, racial trauma, it's not necessarily going to manifest the way in which we have been educated to understand trauma. And so microaggressions, for example, as you spoke to, it may kind of show up in some of those somatic or bodily sensations that we talk about: stomach pain, headaches, things like that, back pain, shoulder pain, but also in terms of insomnia, hypervigilance, just feeling anxious all the time and you're not sure why you're anxious, you're pacing or you're forgetting things. Normally you're great with all of the checklists and all the things that you do, and now you're finding that you have to write things down. All of those things take this invisible toll on the body. And so it's not always those huge, overt things in terms of, being called a slur or knowing that you're being passed over for a promotion. It's just the undercurrent. Oh, you sound so articulate, or that, that's so amazing that you were able to accomplish that. But why is that so amazing? Why wouldn't I have been able to accomplish that? And those dings that happen to us, and then we have to swallow them, right? And I always tell my clients too, in terms of, we also have to pay attention to the messages that we've internalized over the years. And that's where microaggressions become so dangerous, because we begin to internalize those messages about ourselves, and then they become reinforced, and it sinks our self-esteem and our self-confidence. And it may also cause us to deter going down paths that we know we should go down just because we're afraid to show up. Or it just might also be that exhaustion of having to wear masks all the time, just so that we do not have to encounter some of those microaggressions.
And sometimes it's, hearing things in the media, with what's going on in the U.S. and this idea of we're going to be anti-DEI. And of course, this idea that Black people have benefited from a program or haven't worked as hard. And of course, that's not the case. But that can be a challenge, right? And that can be feeling like you have to prove yourself wherever you are.
Absolutely.
Right?
Yep. Yeah.
Okay. Well, that's great. So what are some of the tools or approaches, that you use in practice today? We've heard about a number of different things out there, CBT, for example. Can you talk about what you practically do with some of your clients in terms of helping them resolve these issues?
For sure. I would say, when I do my introductory call with the potential clients, I always say I'm not a purist at all when it comes to different interventions and modalities. I think every client is unique, and so they need a plethora of different tools, right? I can't just constantly, be giving clients one thing all the time, because I think it doesn't provide for that holistic healing. And my philosophy is that I'm supposed to work myself out of a job. At some point in time, you've had enough tools in your arsenal that you can go off and navigate future situations. And if you need to see me for maintenance and checking in, perfectly fine, but you're totally captain of your own ship at this point. So I would say don't necessarily adhere to one modality over the other, but I do definitely bring in a combination. So CBT, DBT, internal family systems. I was family systems trained in my postgrad. So that also is the lens that I will come in to things with psychodynamic, acceptance and commitment, EMDR. So I really kind of bring in, a holistic approach to things. But then I also bring in Afrocentricity and those principles, especially when I'm working with Black clients, to really kind of build their racial identity as well. And so that might be bringing in some of the Adrinka symbols, or kind of understanding the 7 principles that have been, taken from Kwanzaa, but can be attributed to our lives as well, to really kind of reinforce the fact that for the most part, I think people have within themselves the tools to be able to heal themselves. It's access. They need help accessing it, and they need a space where they can kind of unload all of the baggage and kind of store it there until they're able to kind of figure out what are they carrying along with them on this journey as lessons learned, and what is it that they're kind of letting go, and having that space to kind of let that go. So utilizing multiple different variations of interventions, even within a given session, we might jump between CBT and then bring in some DBT to help with some self-regulation. Then we might do some parts work just to kind of, aid and wrap everything up together, and then kind of end off with some mindfulness and grounding. So it really depends on how the client is presenting in the moment.
So there's no one size fits all.
Not at all. Not in my book.
You have the toolbox, and you kind of are using those tools as needed, depending on the client's goals, kind of their belief system and things of that nature.
I call it life jackets.
Right.
So if I can give you a closet full of life jackets, the point is for you to kind of pick and choose which life jackets are going to help you during that storm, right? So you even if the boat gets capsized, you're still going to make it to land because you have the right life jacket for you.
Wow. Okay. And I'm also curious, do you do any work with addiction in your practice? Do you see that? Do you identify that? Is that part of what you do as well?
Yes. And interestingly enough, when I was doing my master's, I did do subsequent courses in addictions and things like that. I mean, I don't do any kind of like hands-on addictions work. Like I would do adjunct work with like an addiction service, for example. But I would definitely say that I do see it. It's just not in the traditional sense. Like it's not necessarily that all my clients may be utilizing substances, for example. But there are a lot of addictions that we use to numb the pain, whether it be shopping, whether it be, binge eating, whether it be, watching excessive amounts of television, whether it be, kind of addicted to unhealthy relationships. And so I would definitely say that I intersect with addiction a lot. I don't know if clients would necessarily attribute that to some of their coping strategies, but I would say if we're looking at the actual definition of it, then yes.
Yeah, absolutely. And we're seeing that more, these process addictions, social media addiction, phone addiction, sex addiction. It's more than just a substance use, right? It's people's coping mechanisms. And so sometimes people may not be aware that they're actually, using addictive behavior, but it's important to help them understand understand that and understand why it's not important, why it's important not to default to those unhealthy coping mechanisms, right?
Yeah. I think psychoeducation is so important.
Yeah.
And I spend a lot of time with my clients just educating them around, brain behavior. Because if you can understand what's happening within you from that kind of neurobiological or neuropsychological lens, it does help you in terms of not guilting or shaming yourself for having these responses, but also understanding that there's a way in which that we can change it, because the brain is malleable. It can change. And so that inspires a lot of hope in clients who feel like they might be stuck.
Yeah, I think that's great. Educating people about the brain and neuroplasticity and dopamine and serotonin and various chemicals that aren't under our control. Well, they are under our control, but we can make those adjustments. And I do think that helps. And that's something that's maybe changed in the last few years in mental health is actually, giving clients some agency around understanding the disease process and understanding how their brain works. So I'm glad that you mentioned that part. All right. So now, in addition to, running your day-to-day clinical practice, you're also involved in a number of organizations. Can you talk about what you're doing and what roles you play?
Yeah, sure. So I'll start off with the Canadian Black Nurses Alliance. So I work as their Director of Mental Health Outreach and Strategy. My role within that is to really support organizations in building capacity for wellness and mental health initiatives that really focus on the Black experience in healthcare, specifically Black nurses, but we recognize that nurses don't operate in silos. So there's an extension and, partnership with other healthcare domains as well. The other organization that I work with is Black Mental Health Canada. So I am a mental health consultant with them. I have curated and have led a lot of training and workshops through them. I also work as a mental health clinician with the Newmarket African Caribbean Canadian Association. And so they have launched a new mental health program specifically for Black children and families, which offers about 8 sessions of free psychotherapy. And we do some group wellness sessions as well. And so I work with them also.
Well, that's great. Okay. So in that, having those multiple roles, that's adding also different streams of revenue for you to support your practice as a whole, right? So in a way, you're operating your business, which is you as a person, right? And you have to be able to bring in, different streams of revenue to support yourself, right? How's that going with your running your business? You have your website as well, right? And what is your website, just so everyone can find you?
It's www.shaniquevictoria.com.
Okay. How did you figure out that you needed to, maybe make your own website? And, it's a really nice site, by the way.
Thank you.
How did you figure out the marketing aspect of this? Is that something you did on your own, or where did you get that advice?
I'm not going to take any credit for it at all. I have 2 great guys who have essentially been behind me the entire time. To give them a little shout out, Matt and Gavin from In Development, they have been phenomenal. And they've actually worked on a lot of my colleagues as well, their websites and things as well. But they were really kind of helped me envision what I wanted, not just in the present, but what did I want 10 years from now?
Right.
And we did a lot of brainstorming and visionary meetings in terms of where do I see myself in the future? And based on that, that's how we kind of came up with the vision for the website, because it has to capture where I'm going, not just where I am right now. And so from that perspective, I think being able to have folks who, I'm going to say first and foremost, believed in me, because I didn't know what I was doing, to be honest. And also could run with my vision, because there were things in my head. It's just I wasn't sure how it was going to translate. And they have an amazing eye for design and for detail, and taking the time to get to know me and encouraging me to get to know myself as an entrepreneur essentially helped to kind of birth what you see now.
Okay, great. So can you talk about why is it important? I mean, and I think this is important for anyone who's a healthcare professional, that you do need to build your own brand, right?
Yes.
You, at the end of the day, are the product.
Yeah.
So why is that important, and how does that help your business grow?
Yeah, you have to build your own brand because, as you said, I'm the product, right?
Yeah.
And people are going to pay or request to see me.
Right.
And I think the important part about that too is how we show up. Because sustainability comes from, can people trust you? Can they trust the brand? And that brand needs to be consistent. And so if you don't really take the time to flush that out a little bit, to understand what that looks like, granted it can change because we as individuals change, we grow. But ultimately, I think it is important that you have a clear idea of, this is who I am, this is how I want to show up in different spaces, so that really lends itself to trust. So when people do call upon you, they know exactly what they should be expecting to get.
Absolutely.
Yeah.
Well, that's great. Awesome. So, I'm interested to hear your thoughts on how the COVID-19 pandemic impacted people's mental health. Now, I know you've been practicing mostly post-COVID,
Yes.
but are you still seeing some of the traumas? And how has that changed also your practice in terms of being able to do virtual things and whatnot? Can you talk about COVID and mental health?
Yeah, I mean, I think COVID on a whole has impacted the mental health of us all, really and truly. But I would definitely say in terms of the Black community, we talk about the statistics that highlighted, that the mental health of Black community was, significantly impacted by COVID-19. And I'd arguably say that it was significantly impacted before COVID-19. It's just COVID-19 illuminated it for us for many different reasons and all the things that was happening in the world. And out of that did come a great push towards focusing on our community and the mental wellness of our community. But and there's been a lot of great work that has been done in this space. But like all great things, sometimes, they fizzle out and people's priorities shift. And I think that has been the biggest detriment here, is that there has been kind of a shift to, okay, we've poured in a lot of resources and money. You guys should be good now.
Right.
Not really kind of looking at the fact that it's not just COVID. COVID was kind of the tip of the iceberg amongst all the other things that our community has had to face.
Yeah.
And much like other things, COVID wasn't handled well when it came to our community once again, right? And so this kind of expectation that somehow, even though great, I stand behind a lot of the organizations and the programs that have expanded and all of that stuff. I do think that it's important to note that it's going to take a lot more time than just what has been poured into it. And I'm definitely seeing that residual impact on my clients now. This idea of like, okay, yeah, once COVID was just over, there was just so much for Black folks. Now I can't find anything for us. Like the deserts of access and services has just grown again, right? Which lends itself to a lot of what the Black community has struggled with in the past, which is distrust in the system, right? We feed it just because it's kind of the thing that everyone's doing. But then when it really matters the most, like, where is it? And so those are some of the things that I would definitely say. And I wouldn't say that there is really any difference between age groups either. I know there was like a focus a lot of our young people were dealing with a lot of anxiety and social anxiety because now they're back with people. And for many of them, especially our younger kids too, like they weren't around people for how many years. But I would arguably say that this toll has also been on the working generation as well.
Yeah.
And just trying to have that bounce back and financial implications that the pandemic has brought and how that has brought on a lot of stress, family breakdown as well. So I think the impact is still being witnessed to today.
Yeah, and I think it took a while for people to realize that it did have an impact.
Yes.
Some people are only realizing now
Yes.
that they've been suffering with anxiety, depression, and other mental health problems
Yes.
that started during the lockdowns and
Absolutely.
isolation
Yeah.
and behaviors, right? So that's definitely still an important problem,
Yeah.
right? I'm curious to hear what your thoughts are on social media, how it impacts people's mental health. I mean, we're hearing a lot in the media about sort of Generation Z and they're stuck to their phones and social media. Is that going to be problematic for these groups? Should we be paying attention to that for parents and for people who are trying to keep their kids, thinking about their kids' future and their mental health?
Yeah, absolutely. Great question. I mean, I'm not a social media expert, so I'll definitely defer to them on some of the specifics around it. But I definitely do think that there is a good and bad to it, right? I mean, the good is that like there is some great information out there in terms of learning how to self-advocate, understanding your symptoms. I know like a lot of my colleagues, even myself, we have, social media channels and things like that where we try to, put out that great information. But I also think on the flip side that there's a lot of negative information out there and just bad evidence that's being put out as well. But I think the biggest thing that I'm seeing that's a little bit, I guess, problematic for me is just the breakdown of communication and socialization, right? When I see some of my young folks in clinic, it's the inability to have a conversation, right? Like take dating, for example. Like dating nowadays with the younger generation is foreign to me. Right. I will be honest. And I have to ask them to kind of like educate me about how this works. But like sometimes I'm kind of like, why don't you just have a conversation? Yeah. It's like, no, Ms. Shanique, we cannot have a conversation. That's not how this works. But I was like, but when you think about it long term and the sustainability of relationships, you have to know how to communicate.
Absolutely.
One-on-one.
Face-to-face.
Face-to-face, right? Not just these little things that you do with text.
Yeah.
And so I think things like that where it breeds a lot to some of that social anxiety pieces. But not only that, I think it takes away from our need for connection.
Absolutely.
And human connection, as you said, face-to-face, body-to-body connection, which makes me wonder, like, really and truly, how are folks going to be able to sustain community? Absolutely. If we can't be in the same room, put our phones down, and really kind of have a conversation.
Yeah, because we're getting these dopamine hits from social media, right? And it's affecting our neurochemicals. Yes. And so maybe it is satisfying some of that desire, those normal kind of interactions that we would have, right? But that's problematic because then you go into the real world and people don't know how to communicate. And
people don't operate like that.
I mean, we see these like kind of these iPad kids who you ask them a question when you go into a store and they're like, completely socially awkward, right?
Yeah, just basic social skills, being able to like ask for directions or figure something out, just on your own. And I'm not taking away from the intelligence of our young people. I think they're, extremely intelligent. They, they are creators in their own rights and all of that. But I do think that some of the quote unquote old school ways of doing things do have their benefit.
Yeah, exactly. Yeah. And we kind of grew up in a generation where we didn't have that growing up. I had a cell phone that was like a Nokia at one point, and you could send a text. Yes. It took 20 minutes to write it. But, these kids growing up with an actual computer in their hands, it's a completely different problem that we might see, right?
Yeah.
Okay, and now I'm wondering if you can clarify something I'm sure our audience wants to know, is what's the difference between a psychotherapist, a social worker, and a psychiatrist? Okay, yeah. Because people use these words sometimes interchangeably, but can you talk about the difference in terms of, education, but also what types of services you might get from each of those providers?
Yeah, for sure. And I'm also going to lump in a psychologist in that
Psychologist, yes.
Because that's sometimes what comes up as well. Psychiatrists are medical doctors, and they do assessments and diagnosis. They also do medication management as well. And I know some psychiatrists who will do actual like psychotherapy as well, or therapy with their clients, whether it be in groups or individually one-on-one. Psychologists kind of in the same frame, but they have PhDs. They also do assessments. They can do diagnoses as well. And they also, from that lens, can do psychotherapy, and some of them do have their own private practices to do that as well. And then the biggest one is the social worker and the psychotherapist vein. And so both of them require master's degrees. The difference is really in terms of like our education. So social workers do psychotherapy amongst other things. Yes. And their job really is to connect folks with community. What do they need in order for their whole entire social being and their social welfare, essentially? So if that also includes, depending on their job and their role, it may be accessing services, making sure that they have, housing, making sure that they have things that they need in terms of food security or child welfare things, for example. And then they might do some, psychotherapy as well. So as psychotherapists, though, our role is just the therapy piece.
Yeah.
And we're just really kind of focused on bringing forth evidence-based interventions into the therapeutic space. So it extends beyond just talk therapy, because that then would just be a counselor, which, and so we bring in, for example, the CBT, the DBT that we talked about, EMDR, these different modalities that we also have to be trained on in order to be able to facilitate. And I would arguably say, because we're psychotherapists, we're not social workers, but for many of us who work within underserved populations, we oftentimes take on that hat sometimes. It's not within our scope of practice, but inadvertently, in order to really kind of do some of the therapy work with our clients, we do need to help them in terms of some of the access points. And so we will be oftentimes interconnected with social workers or social programs just to ensure that our clients are also supported, but it's not within our actual scope.
Okay. So thank you for clarifying that. I mean, I think it's important for people to understand in Ontario, psychiatrists typically are involved very little with patients. As a family doctor, I might get the patient to see a psychiatrist once a year at best, and it's really for diagnostic clarity. It's really for patients who have primary psychiatric problems, schizophrenia, bipolar disease, that require medical interventions. Pharmacotherapy really is the mainstay in Ontario. Whereas, social workers are often involved even in hospital settings with getting patients access to resources, ODSP applications, helping them get money and things that we need, right, that are critical for them to survive. They do also, like you said, do psychotherapy, but that's not their mainstay necessarily. Whereas as psychotherapists, you're primarily doing that therapeutic intervention. You're utilizing a number of different evidence-based tools to do that. And so that's kind of your focus.
Absolutely.
But in your practice, do you also interact with a multidisciplinary team, I imagine, and sometimes are cross-referring to, if you have a patient who might need a psychiatrist or a family doctor?
Absolutely. And that's why I say, even within our roles, even though we're focused on the therapy, for example, I have some clients who, just because of my own background within the medical field, I recognize that it's hard for us to start any therapy work unless you have medication. Not that I'm pushing it on the client, but just recognizing that we're in a space of resistance that medication could potentially help, right? And this is where it would become like advocating for them to go follow up with their family doctor about that. Or on the flip side, clients who really and truly, because of, for example, food insecurity, right? It's really hard for us to be thinking about doing any form of CBT when you're hungry and you're tired and you're stressed. So it would be about letting them know there's this program within your community, reach out to them and see what they can do to be able to help you. And I've also noted within our community, it's not just a matter of giving them a list of things to go and see, and I mean, granted, recognizing everybody might be busy, but it's curating those relationships where I know you go and talk to Nancy so-and-so, she will be able to help you do this, that, and the other, so that they can actually then kind of get that connection, get that support that they need, so that then we can come back and then do our work that we need to do.
So you need to kind of have a foundation of basic things, basic needs taken care of. Can you talk about the differences in Ontario with access, and I mean insurance? If someone, obviously there's patients who have great insurance, there's different levels. And there's some people who have no insurance, and OHIP, unfortunately, is not the best when it comes to psychotherapy services. So what are you seeing, and what are the different levels that exist?
Yeah, and I think it's so unfortunate. I think one of the basic things that I'm seeing is that insurance companies will cover social workers, but they won't cover psychotherapists for psychotherapy, right? And so that already is a barrier for a lot of folks. There's some great social workers who are doing practice, but a lot of them work in organizations where they're not in a private practice, right? So right there, that limits that. And then how many of them are Black? That may limit that pool as well. So that's the first point of access that I'm seeing. And then also in terms of how much they'll pay out, right? If you have great insurance that really, the organization has really advocated and they recognize the need for mental health services. I've had clients who they can come as many times as they want, no problem. They'll cover pretty much 100%. And then on the flip side, you have clients who are like, okay, it's $300. Well, essentially that is only to sessions, essentially, right?
It's like, hey, intake, and then boom, one session.
That's
maybe,
it, right? And so, and I mean, it puts a weight on the therapist, right? And I've had clients who approach me and they have said, I only get this much for the year. I really need therapy. Any way we can work it out. And I mean, if my sessions are typical $160 a session, let's just say, right? I've had clients where I was like, okay, we'll work with your insurance, which essentially is like, I'll charge you $35 a session. Right. So it creates that imbalance, because if this was all that I had as my revenue stream, how is that practical for my clients? Or the other part of it too is that they're just paying out of pocket, right? And the hope is that they'll claim it on their taxes and get that tax break. But we also know that there's some implications to that as well. And so I would say definitely for our community, I would say about 80% of my clients do not pay my full fee. They just can't afford it. And I don't think that cost should be a deterrent to getting support, and I'm grateful that I can be in a position where I can offer that. But it's a lose-lose here, unless there's some changes.
Okay, so in some of the programs that you're working with youth, are there funding for some of those programs?
So the work that I do with NACA, the New Market African Caribbean Canadian Association, for individuals who are under the age of 18, there are 8 free one-on-one therapy sessions with a clinician. And you just have to sign up and register. So those are fully funded. And we also do some group therapy, some group wellness and family therapy as well. And then I would say, like, Black Mental Health Canada, I do believe that there is some forms of scholarship and things like that if you need support for mental health services. And a lot of the clinicians that I am associated with offer sliding scales just for this reason as well.
Okay.
Yeah.
So you do offer a sliding scale, as you mentioned, meaning you'll see you'll look at a case by case and try to work with the client to get them what they need. And I think it's important for people to understand that it's not going to get better in 1 or 2 sessions, right? We're looking at sometimes years of work to help. What's an ideal situation in terms of how often ideally do you want to see clients?
Yeah, I generally, if there's no like acute crisis situations, biweekly is good.
Okay.
It helps to build that momentum. It helps to, really kind of keep the relationship intact. And also it gives clients enough breathing room to be able to do any homework that they need to do any reflections that they need to do, and have that time to really kind of process what happens. A lot happens within that 50 to 60 minutes. And sometimes folks don't really understand or feel the impacts of it until maybe 3, 4, 5 days later. And they need some time to be able to sit with that. So generally I say bi-weekly. Granted, of course, I have clients who, for whatever reason, they can only afford maybe like once a month. That's perfectly fine too, if that's what you can afford. But I think the sweet spot is bi-weekly.
But it should be in kind of regular intervals over a longer period rather than trying to compress it all in, right?
Correct. Yes. Okay. I don't advocate for, and I mean, I've had clients who've had to see me, twice a week for whatever reason. And oftentimes it's because it's associated with that they're just having a really hard time and they need that support, and that's perfectly fine, or once a week if they're going through a challenging period. But then, we will kind of go back to our every 2 weeks when things seem to stabilize.
Okay.
Yeah.
Okay, great. So in addition to your clinical work, you've also been involved in public speaking, which I'm sure has helped with, promotion and just getting your name out there. What type of events have you done in the past?
I've done quite a number of different events. So I've done like panel discussions for community agencies, for governments as well. I have done corporate events. I have done keynote speaking at conferences. I have done kind of Black wellness facilitation as well. I've had the opportunity of being able to experience different areas of focus. So not just in terms of healthcare, but also like legal, like I said, government, and then community as well.
Okay.
Yeah.
And why do you think it's important that we keep the conversation conversation about DEI going and, not listen to some of the rhetoric that's out there about how it's not needed or we need to cancel everything. Why is that important for our community?
It's important because systemic racism still exists.
Yeah.
And as long as it exists, it's important for us to, acknowledge it. And I think that's what DEI allows us to do at its elementary level, is to acknowledge that it exists. But at its highest form, when it's really operating in its full functioning, it drives equity work that ensures that there is equality for all, that there's access for all, that there's understanding in a room for all, and respect for the differences that come with people who are from different backgrounds. And so from that perspective, I think when we do away with it, we're essentially doing away with the lived experiences of people who still have to experience systemic racism day in and day out.
Yeah, that's really important. And I think we need to keep the message going.
Absolutely.
And it needs to be aware. People need to be aware of the importance of this. It's not just for the Black community, it's for all communities, right? DEI does not just mean helping racial diversity, but also people who have disabilities and other differences,
absolutely.
right?
And I can understand and appreciate the difficulties in trying to actually do this work. And I think a lot of the speaking engagements that I've done to date have been, what has come back to me is, okay, Shanique, so how do we do this, right? And so late last year, beginning of this year, I really kind of put all that together with the research that I had been doing and put together a framework called the Culture Framework that I've been piloting with different groups to really kind of look at how do we do this in a tangible way and give folks something tangibly that they can walk away with and say, okay, like if I'm looking at these various different pillars and I'm asking myself these various different questions, this is how it can show up. Because this is how it shows up in my clinical practice. This is how it shows up in our organizational design. This is how it shows up in terms of how we're doing our program development and our research. And so I think things like that, where we're really kind of giving community things that will help mobilize them in the field to do this work, may take away some of that heavy burden of trying to figure out where do we start.
Okay. And in the workshops that you do, what is that like? Are you going into, say, a corporation and talking about DEI, or what specific things are you doing there?
I'm a hands-on learner myself, so I like to bring that type of experience to the workshops that I'm doing. So whether we're doing it virtually, whether we're doing it in person, I'm coming into an organization or a company. It's really and truly about how do we utilize everything that's happening within your organization, within your clinical practice, and put it through something that ultimately will help drive the work that you're looking to do. And so, kind of just bringing it back to an example within this framework, what I've worked with organizations in doing is kind of going through the different pillars and some of the things that they're already doing effectively. What are some of the things that they can work on strengthening? And we do a lot of case analysis, right? Okay. Bring me a story, bring me a situation from your organization, from your clinical practice. Let's work it out so that you can walk away with something, again, that you can say, okay, so this was kind of some of the transferable skills or the transferable lessons that I can apply to the next situation that arises.
Okay, so it's helpful for, you say, various corporations in terms of how to create that culture that's inclusive and that's accepting, and how to create a friendly, safe work environment. And I think that's something that every business needs, right?
Absolutely. We've had great feedback on it, actually, so it's good.
Now, where do you see your business going in the next 10 years? What are your goals? Where would you like this to go? Do you want to expand it? Where do you want to bring it?
Yeah, absolutely. I definitely see things on an international lens. I mean, we do a lot in terms of mental health and mental wellness here in North America. But I think about, kind of going back to my quote unquote home country, my parents' home country of Jamaica, and then other, countries of the diaspora, and really kind of helping to fortify their wellness programs as well. I don't think we operate in silos. We're all a part of this bigger community. And so I think if long term, at some point in time, if there's some connection in that international space, I would be really proud and happy to see, the work that I'm doing expanded and making a difference in some of these other communities as well.
Yeah, I think that would be a great opportunity. I mean, here in Canada, we are kind of leading the charge in mental health. But there's a number of, developing countries in, West Africa, in, the Caribbean that are starting to really get up there, but need that mental health work. They're still lacking behind. And so I think that sounds like a really exciting opportunity for you.
Yeah, and I'm all about collaboration, right? Everything that I do is in collaboration. This is why I'm interconnected with all of these different organizations. I think, that old proverb in terms of like, if you want to go somewhere fast, you go alone, but if you want to go somewhere far, you go together. That's really a guiding principle for me in terms of there's room for all of us at this table. And it's necessary that we're all sitting at this table because everybody has their unique experiences. There's not just one Black experience that can lead the charge here, right? We need the voices of multiple people.
Yeah, it's diversity within the Black communities, really, right? Yes. We're all from different places, and there's many of us, but we have to work together and unify for a common goal, right?
Absolutely.
Okay, so now I want you to look back into the past when you were just getting started, first year undergrad. If you could go back and give yourself some advice, what would you say to yourself?
I would say two things. The first being enjoy the process. I think navigating post-secondary education, first generation Canadian, was challenging, right? My parents worked really hard, but they didn't have money saved to pay for our education. And so with that came a lot of stress, a lot of trying to navigate, how am I going to pay for this, all of that pieces. And so I think that kind of stripped away from my ability to be able to really enjoy the process. In my undergrad, I was working like 3 jobs to pay for school and just to pay for rent and all of that stuff too. And so it just kind of stripped away from my opportunity to have that that type of an experience. But I think if I wasn't so stressed about those things, I would have been able to enjoy the process more or found ways to create that for myself a little bit more. And I think the other piece that I would say is to just be flexible. I went into school with a vision. Like I said, I wanted to be a neurosurgeon. That's all that was on my mind.
Well, you'd still be in school right now.
And I would still be in school right now. And I would say that, life events that ultimately led me in a different direction, there was a lot of devastation at that time of not being able to accomplish that quote unquote goal. But it has landed me into, some more beautiful territory that I probably never would have gotten into before. And so I think that if I was a little bit more flexible, again, I would have been able to enjoy the process a little bit more.
Right. So I'm hearing enjoy the process. It's about the process. It's about the journey, not necessarily the destination, and give yourself some flexibility. Okay. So where can people access your services? Is it through your website? You're also, I think, on Instagram and social media. Can you tell us where to find you?
Absolutely. So you can go to my website, www.shaniquevictoria.com. On Instagram, I'm at Shanique_Victoria. The same thing, I think, on Facebook. I'm also on LinkedIn. Or you can email me, hello@ShaniqueVictoria.com. And
people can reach out directly and ask you questions and try to access your services. And you have space in your practice right now?
I do, yeah.
Great. Okay. Well, thank you so much, Shanique, for coming on. It was an amazing conversation. Looking forward to seeing where you go with your business. And I'm sure the audience will get a lot out of today's podcast. Thank you.
Thank you so much for having me. This is wonderful.
All right, great.